Oh, y'all gonna have to be louder than that. These walls are thick. Good afternoon.
Good afternoon.
We are here today because for months we have been organizing and talking to family members of residents and caretakers about the staffing crisis in our nursing homes, right?
Yes.
We are here today because we are the only state in New England that does not have minimum safe staffing. And we're here to change that, right?
Right.
There are those who said that we couldn't organize. There are those who say that we're not going to be able to win. But we're here today to say we're going to win, right?
Yes.
Are we going to win?
Yes.
Are we going to win?
Yes.
Excellent. Our first speaker today, I'm honored to have with us one of our sponsors, the Senate Whip, Mary Ellen Goodwin, who's going to share a few words about why she has decided to support this campaign and this legislation.
Thank you very much. Thank you, ladies and gentlemen. Let me just begin by saying I'm privileged to sponsor this legislation. Okay, I'm doing the best I can. I'm privileged to sponsor this legislation.
No. The mic is...
It is. Maybe I have to come a little closer.
The mic has to be right in front of your lips.
Okay, right in front of my lips. Thank you. Okay. Come on, after all these years in the assembly, I should know what to do with a mic. Ladies and gentlemen, let me just say I am honored to sponsor this legislation on your behalf. I have sponsored other legislation on behalf of this good cause, but I pledge to you that this is going to be my #1 legislative priority this year. And I'll just share with you, legislation doesn't happen by accident. A few minutes ago, I was joined by my leadership, the Senate President, the Senate Majority Leader. I see Senator Felag is here with me, Senator Erin Lynch. I saw Senator Frank Chacon. I see Senator Val Lawson, because it will take all of us to ensure that this happens. I mean, it is amazing that we are, and embarrassing, quite frankly, the only state in New England that doesn't have the staffing minimum requirement. I wonder how many families in this state realize that their loved ones don't even get a minimum of 4.1 hours. It's ridiculous. And let me just say, we're going to fight to the very bitter end so that your wages, in some small way, try to reflect your worth. Because I'm telling you, no wage on earth could really reflect what you do. You are angels on earth, and I have seen it firsthand. You do God's work, and you really are so very hardworking in those facilities. I know firsthand, you do all the work. And my parents were the recipients of so many great caretakers. So ladies and gentlemen, I'm just going to pledge to you, you have my 100% commitment that this is my top legislative priority. Thank you for joining me here. I look forward to working with your leadership. Iman and Pat, they're here every day working on your behalf. You're lucky to have them. And I'm lucky to have your past support. And again, I'm just going to do all I can. Thank you very much.
Thank you, Senator. Make a little bit more noise. There we go. Okay, so next up, we have caretaker Vicky, who's going to share what it's like to try and provide care without the protection of safe staffing and the requirements that we need in this bill. Right up to the lips.
Hello, everybody. Can you hear me? All the caregivers sitting in the house say, yo! We're here to raise the bar. My name is Victoria Mitchell. I work at Hopkins Manor for 23 years as a CNA. And I want to say thank you to Representative Mary Ellen Goodwin and Senator Mary Ellen Goodwin and Representative Scott Slater for introducing this bill. And I want to say thank you to every one of you guys that took your time today, family member, resident, patient, CNA, caregiver, for coming here today to promote this bill. know we're going to speak out. We're going to speak out. Somebody asked me most of the time and say, what do you love about your job? And I look at them. I say, all CNN know here, the blessing they gave us all the time. Thank you for giving me a bath. Thank you for taking me to the toilet. Thank you for feeding me because I cannot feed myself. Things that we take for granted every day. Other people cannot do it for themselves. We take to go to the bathroom when we want to. But these people in the nursing home wait for people to take care of them. Let's keep it real. Today, you can walk and take a shower. Other people depend on us. And they wait patiently. Is that fair? Is that fair? No. Let's forget, we all going to get old, and someday in our life we're going to get sick. Today you can be in here and walk on the street and get in a car accident. You cannot move your hands. You need caregiver. You need CNA. Doctor will save your life. Nurses will give you medication. CNA will clean you up. It's about time, man. I'm tired. I reached a point, people need to know the truth. All right? We go, we work short. You get 10 people, divide 10 by 7.5, taking your break. 10 residents in the morning. You the caregiver at the same time. You sharing the breakfast at the same time. You making the bed at the same time. How many hours in a day? Fresh shift is 8 hours. Take your break out. 0.5. And you're taking care of 10, 11 people. So we need to raise the bar. We need to pay the people that take care of your loved one, sick one, decent wages. So we reach our point, we're going to speak out. We're proud of what we do. We are angels. When you're sick, you appreciate seeing your name. They call us angels, angels, angels. Thank you, everybody. Let's raise the bar. Thank you.
Thank you, Vicky. We know that the only way we can raise the quality of resident care is if we are able to recruit and retain quality caregivers like Vicky and like so many others who are here. Until the industry begins to pay a fair wage, a living wage, nursing home residents are going to suffer, and those who care for nursing home residents are going to suffer, and so that must change, yes? Yes! So next I'd like to introduce State Representative Scott Slater, who is the sponsor of our bill in the House.
Thank you. Thank you so much. Thank you, everyone, for being here this afternoon. It's a wonderful honor for me to be able to sponsor this legislation. I'd like to thank my sponsor over in the Senate, Senator Mary Ellen Goodwin. Thank you. We've worked so well on so many issues, and I'm looking forward to working with her on this issue, which is so important to so many of us here. Thank you to all of you here today who came out, especially all the CNAs, the caregivers, the people on the front line. Another round of applause for all of you guys. Thank you. I'd also like to mention a lot of my colleagues that are here today that came out to support this rally. And as Senator Goodwin was saying, we can't do this alone, so we need help of our colleagues. We need help of all our other legislators. So I see Representative Bennett here, right in front of me, Representative Lyle. I see Representative Dan McCannon, Representative Anastasia Williams, Representative Ray Hull, who's behind Representative Joe McNamara, Representative John Lombardi, Representative Marcia Ranglin. I see Representative Donovan before, Representative Greg Amori, Representative Mary Messier. Thank you. Thank you all of my colleagues and anyone else who's here that I might have missed. Representative Gregory, Representative Kassar, and Representative Kislak. Great, thank you. All my wonderful colleagues coming out to support. Who else did I miss? Oh. Sorry. Representative June Speakman, and who else did I miss? Yep, I see Representative Kassar. Yep. So, so let me go in. I have this sticker on my shirt today. It says I'm here for a family member, and that's the truth. So over the past couple years, I got to know some of the folks that are here today are directly taking care of my mama on a regular basis, whether it's been at the assisted living or at the nursing home. So this issue personally affects me and my family, as many of my constituents and many of their family members. Like many Rhode Islanders, my family has faced these challenges. All nursing home residents should be guaranteed adequate level of care. And honestly, I don't think it's too much to guarantee our seniors and most vulnerable residents a minimum of 4.1 hours a day. So, over the last several months, I've gotten to meet many CNAs and frontline nursing home workers. They are angels, and they provide so much care for so many of our vulnerable, our elderly parents, our aunts, our uncles. Thank you for all you do on a regular basis. We know residents get better care. We know residents get better care when they have consistent staffing. And the main part of getting consistent staffing is paying not a living wage, and also making sure that CNAs and the direct care folks aren't overburdened with too many residents on a regular, and residents are guaranteed a certain amount of hours of care each and every day. So thank you all for being here, and as it was pointed out, we're facing a democratic wave of baby boomers hitting retirement age. In order for this workforce available to our seniors in the coming decade, we need to make sure the workers that want to take care of our seniors can also afford to take care of their family. So thank you all, and we're going to fight very hard for you this session, and with all your support in this campaign, and the leaders that you have working on a regular basis, and Senator Goodwin and all my colleagues, I'm very confident that we're going to get this legislation passed. Thank you very much.
Thank you, Scott. So we know that this story about what we need to fix and what we need to raise involves caretakers, and it involves family members and residents all together, right? Next, we're going to hear from a family member or resident who's going to let us know from that perspective why it is urgent that this issue be fixed. Those of you who are on the stairs, there's more room up here if you can come on through. Next, I'd like to introduce Antoinette.
Good afternoon. My name is Antoinette LaMontagne, and I'm a lifelong resident of Rhode Island. I have worked in the healthcare industry.
Okay, so everyone's going to do the best they can. She's doing the best she can, and if we're really quiet, we'll be able to hear.
Sorry. I'll scream.
Just look closer, look so better.
I have worked in the healthcare industry most of my adult life. I'm here today in support of the Home Staffing, Nursing Home Staffing and Quality Care Act. Healthcare is an important issue. Good care is even more important. And that cannot be possible without our bill being passed. Having many family members in a nursing home facility, I have had the misfortune of many negative experiences. My aunt was a diabetic and an amputee. She was a resident for long-term care and was totally dependent on the facility for her daily care. Many times upon visiting, I would find her still in bed at 1 o'clock, not washed or dressed.
She's doing the best she can.
Sorry.
Let's hear it for her doing the best she can.
Right. I'll scream. One particular visit in which I will always remember was finding my aunt in bed, waiting for the rescue to arrive. She had scrapes, bruises, cuts, and mulch sticking out of her face. It was the result of her wheeling herself past the desk, out the front door, and into the parking lot. Sorry. I still can remember the horrific feeling when I was told of the details. I also would witness many residents waiting, as we were told, waiting to go to the bathroom, waiting for water, waiting to be fed, waiting to get off the toilet. Simple daily care we get to do every day. It doesn't happen when there isn't any staffing. These are just a few of our loved ones that have to deal with us every day. While these daily requirements may seem minor and not a priority when there isn't enough staffing, they are requirements to sustain a will to thrive for our aging population. Our loved ones and family members deserve better. They deserve to be well cared for. It is our hope that long-term care with better staffing so that all of us here today in the future will have safe and quality care. Thank you.
Thank you, Antoinette. We know that we're building a movement that's going to win, right? Because we're building a movement that's uniting all different people who are affected by this. A movement of people who are coming out of the shadows. Because for too many, they have no idea what it's like to be in a nursing home. They have no idea what it's like to be a caretaker. And they have no idea what it's like to see your family members suffer because there isn't enough quality care. But we're ending that, and part of how we're doing that is we're coming together with the community. And the community is working together with all of us so that we can shine a light on what's wrong so that we can get what we need done. And I'd like to introduce our next speaker, Sister Geeta. I always get the title wrong, but I believe Executive Director of Sister Fire.
We'll work with that.
Okay. Right up to the lips.
Okay. All right, y'all, you ready? Are you ready? All right. Sister Fire is standing here today because we are a network of women of color. We are tired of our sisters struggling. We understand what it means to fight for what is right. We are mothers. We are sisters. We are daughters. We are the backbone of what fights and what stands for our communities. We are here with you today because we believe in your fight. We believe in being in coalition with what you are fighting for. That means our families who are in nursing homes, my brother, my uncle in Bannister House, what it was like when we weren't there, when we didn't know what was happening. We had to rely on you to look out for our family. Sister Fire stands here today because we want you to rely on us to have your back. We understand the crisis. We understand it is critical. We understand what it means to work hard. When you work so many hours and then you have to go home to your family, that's what they often forget about. That what you do when you get home, you don't get to go to sleep. You get to fix food for your kids. You get to take care of your partners. You get to take care of your own family. It doesn't stop. When are we going to be valued as women of color in this state? When are people going to recognize what we do in this place? What do we do as all women? The fight is ours to win, y'all. The fight is ours to win. Let's stand up. Let's walk towards what our future will hold for us. Because resources are critical. Rents are raising. We got to be able to do for all of us, not just one of us. What does it mean to have our collective power moving us forward? I thank you, I appreciate you for all that you do every day, whether it's my family, whether it's someone else's family. We believe in you, just like you believe in us, and together we will win. Thank you.
Thank you, sister. One of the reasons why caretakers are not paid what they should be paid is a huge secret that we all know. It's because 70% of caretakers are women of color. And we know that it's only because of that that the bosses feel like they can get away with paying us what they pay to take care of some of the most precious cargo we have as a society. And so until we address that racism, we're not going to be able to turn this around. So we have to not be shy about that. We have to call it out for what it is.
That's right.
When we are dealing with an industry of for-profit nursing homes that are happy to make millions while people are suffering, while people working for them are not getting paid what they should be paid, while residents are getting neglected because there aren't enough staff to carry out the work, we are dealing with evil. And what I know is that when we're dealing with evil, it's time to call in people who know to call down some righteous justice, right? So with that, I'd like to bring up our next speaker, Rabbi Jeff from Mount Sinai, Temple Mount Sinai. Thank you. It's got to be right up against the lips. Good afternoon, everyone. All right, my name is Rabbi Jeff Goldwasser. I'm from Temple Sinai in Cranston, and I'm also a member of the steering committee of the Rhode Island Interfaith Coalition to Reduce Poverty. I'm here today to represent the coalition and to voice our support for Raise the Bar on Resident Care. There is a crisis today in Rhode Island in the care we provide for residents in nursing homes. Too often, nursing home residents are left to spend their days with a substandard amount of meaningful human contact and with inadequate attention to their physical, emotional, and spiritual needs. Often, they have limited contact with family or have no family at all. Often, their caregivers are their family. The bond residents form with their caregivers is an essential part of their quality of life. But increasingly, nursing home caregivers who do this work because of a moral commitment to improving the lives of others don't even have time to talk to their residents. The crisis for nursing home residents is also a crisis for those who care for them. Nursing home workers who care for residents who are subject to that lack of attention suffer along with the people placed in their care. Their work becomes ineffective, unfulfilling, and meaningless. This is in part why it has become so difficult to recruit and retain nursing home staff. I know, and my fellow clergy, we know that the people who provide residential care are engaged in holy work. They are the ones who pay attention to the needs of our elders, who care for some of the most vulnerable in our communities. These people are the ones who embody the scriptural command, "Do not cast me off in my time of old age. Forsake me not when my strength is spent."
is our obligation as a society to make sure that these workers are treated according to the dignity of their profession. That is why our coalition advocates for a minimum staffing standard of 4.1 hours for every resident in a Rhode Island nursing home. Nursing home residents deserve consistent staffing to assure that they are cared for, appreciated, known, and valued. Nursing home caregivers deserve to work in an environment where they can see that the residents they care for are treated with dignity and love. Caregiving workers deserve to see how their work can be effective, fulfilling, and life-affirming. Thank you very much.
Thank you, Rabbi. Our next speaker comes from an organization that does very important organizing work with seniors in Rhode Island, and they're also we're proud to have them as partners in our coalition. Ray, Director of Rhode Island Organizing Project.
Thank you for having me. The Rhode Island Organizing Project is proud members of the Raise the Bar Coalition. We spent a number of years organizing around the no-fare bus pass, and most of the people that we work with earned under $800 a month. Many of them were in poor health, and many of them are most likely to end up in nursing homes. One of our members fell. She was in her late 70s. She was very frail, but she was able to get around and carry on her life. But after she fell, she ended up in a facility, in a nursing home. And she is luckier than most. She has family to visit her. She has folks from her church to visit her. I visit her every couple of weeks. But there was a member that lived in the nursing home. She had no one to visit her. No one at all. She was all alone. She spoke a language which none of the other patients spoke, so she had no one to talk to. The only people that could deal with her were the staff. They provided her care, but they were the only human interaction she got every day. She deserved minimum staffing standards. The staff that worked with her deserved a minimum staffing standard. They deserved a workload so that they could properly care with her staff. The staff that worked with her deserved better pay. The staff that worked with her needed better access to training. So I look forward to coming back here in 3-4 months when we celebrate joining all the other New England states and having a minimum staffing standard.
Thank you, Ray. Okay, so in just a minute, we're going to be going in and lobbying the legislators. Can I have the lobby captains raise your hand? Phil, Linda, where are you? Lobby captains, raise your hand. All right. Before you leave, make sure you leave not with one flyer, but with a handful of flyers for the next event, which is going to be on Saturday, March 15th. When we know we can bring everybody out, right? Yes. All right. So just so we can make sure that all the politicians hear us, let's do this one more time. Whoa! Want to make sure they all hear us.